Hello and welcome to Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully. Thank you for
Hey,
joining us.
hello, everybody. Good to see you virtually.
Yes, virtually. Hey, let's see. Let's give people a minute to log on. And let me ask you. I'm going to think of a question off the top of my head. Okay, here's one for you, Dr. Tully. What does it take to be a veterinarian? Like when you have people, an avian veterinarian, like when you have people who are students who are interested in working, on exotics and birds and stuff, what sets them apart from the ones that tend to go towards the dog and cat veterinary services?
Well, I guess first of all, the ones that are looking for birds and companion exotics, they have to be adventurous. I believe they have to have a desire to treat animals that are not conventional, and so that's usually like I said, people that are adventurous and that want to kind of push their knowledge and their expertise and what they want to do, knowing that there may not be all of the answers that are there, but that they will utilize the medicine that they are taught and apply that to birds and other animals, companion exotics. And so with that, then they will do usually try to get involved in any of the student organizations. They will try to work at practices that see these animals. And then also, as with at LSU, you can track the zoological medicine so you can get more exposure to the medicine that's involved with the birds or also the other companion exotics, so that they can actually, if they have a passion for this, then they can start developing more expertise in this area.
Nice. So is it like an exciting day when the students like start doing like hands-on like work with actual birds? Like are some of them a little bit like, oh my God?
Well, exactly. Well, here, and then there's a number of opportunities at different veterinary schools and colleges where they can get involved with working with the animals. And the general trend toward education at this time, in particular veterinary education, is getting the students actually exposure and into the clinical medicine early in their careers, where when we were in school a few years ago, you actually were in class for 3 years. You did have some interaction with animals, depending on the labs that we did, but very little applicable clinical medicine. And so the trend is to get the students early on in that. For our students, and like I said, and then other schools and colleges, they actually have, we have a wildlife unit where we have some of the first through third year students that are usually in the classrooms can get involved. They can take care of resident raptors. They can take care of the birds in the flight cages. So they do get some exposure at that time, and so it's good. It kind of is a stimulus as opposed to just looking at the books, and so this is something that they can do. But it is it's exciting, but as you can imagine, for the student, it can be a little bit apprehensive because now you have to do it, right? And so we want to try to teach them in a way that they will be comfortable with handling and being able to treat and actually work on a case that they can get and get their expertise and develop some experience.
Nice.
Yeah.
That's
So,
interesting.
you know, so some would say, yes, it's exciting. And others, just like when you graduate, you get your diploma, you have your licenses, and then it's like, all right, this is where I finally made it. And then it's like, now you're the doctor, it's like, so it's exciting, but yet, so we try to do everything we can to prepare them for that day so that they will have the confidence and the ability to perform their duties in a outstanding manner.
Nice, nice. On that note, we're going to talk to a real veterinarian, Dr. Tom Tully, and I got some veterinary questions for you. So all those years of teaching and being through school yourself is now going to come in handy. So if you're just joining us, you're at Ask the Vet with Dr. Tom Tully. And just a reminder, of course, to use the Q&A button instead of the chat button so that we can capture the question. And I think we'll get started here. Do you want to dive into questions, Dr. Tully, or?
Well,
already.
Well, I guess we can go ahead and get into the questions. Brenda, Laura, we could go ahead and get into the questions, and since they're our attendees are there, and sometimes we run out of time, so we can go with that.
And Brenda is our person behind the scenes. So
yes, I'm looking at her name.
Doing the chat workforce. So let's see. I've got a first question up for you is from Kim. She has a cockatiel with a locked ankle from a hairline fracture on the outside condyle of the hock. What can be done to improve flexibility?
Well, this is it's excellent, and everybody always has excellent questions, and we learn together. the how this fracture is, if you have the little the bird's foot and on this, then you have the ankle of the bird's foot, and then you have a fracture of the very very end of the foot. So if this was the bird, say this was the bird right here, then what you're looking at is right here is where she's talking about the little fracture. This is the knee, this is the hip up here, and this is the little the ankle, and this is the foot, and the birds walk on their toes and perch on their toes. So the end of this bone, called the tibiotarsal bone, was fractured. And so what happens is that it affects the joint. So you have a stiff joint. And really, the little bird will do fine with the stiff joint. And we have done studies to determine what the normal angles are here and here. So if we have to make a stiff joint because of some type of an injury or disease condition, that we put the bird in a normal perching angle, so that when it perches, that it's not abnormal, so it could affect the other leg. And the bird's going to do fine. And then if you try to, and with everything as it healed, it kind of froze that joint, and you can do more harm in trying to make it have more flexibility than not. So I think what you have is a bird that has healed that way, and that and in trying to give it and provide more flexibility may be more harmful than good. The bird will do fine. Parrots, we've amputated legs, and they have done well on one leg. We even amputated a starling that was coming in for nail trim, and you can own a starling. They're not native birds. They talk. So, you know, there's a recommendation to get the starlings out of the wild and get them into your house. But nonetheless, it had its leg caught in the cage on its way over, and really just almost self-amputated that leg. And we amputated that little starling's leg, and it's done well. But for parrots, they could go around with their beak. And so with this little cockatiel, with what we just say a frozen joint, it'll do okay.
Okay, and would there be any kind of perching concerns on what kind of perches you offer, or just standard regular?
Yeah, just standard. The joint it's probably can use its toes fine. So just the standard purchase should work on that. Now, if it's a single, you know, if a bird has the leg amputated, then you'd want to make sure that maybe some wider platforms that they could go on and move around. But they get and adapt really well on that, and they'll perch on one leg too. So you just want to provide different and varying diameters, like a tree branch, just to make sure that the plantar surface or the bottom surface of the foot, it's the weight is distributed over time. So it's just not perching like on a round dowel, a wood dowel or something at the same pressure points every time at all times. So that's why you want to use normal branches. Yeah.
Okay, we'll branch out. Stephanie says, hi, Dr. Tully, thank you for answering our questions today. My question is about iron storage disease. What is the prevalence of iron storage disease in companion parrots, and is limiting vitamin C consumption sufficient for preventing hemochromatosis in low risk species?
Hemochromatosis or hemosiderosis, a couple of and you ask a pathologist, and there's somewhat difference, and that's iron in the liver. Humans can get it too, in iron storage disease, and that's where you have deposition of iron, and we have iron in the body, of course, for our blood, red blood cells, and so it's good, but too much of, you know, even good things is not good, as you may have heard over time. But nonetheless, for parrots, I would say that we really don't see any, this is not a major concern. I would have to say that there are so many other diseases that are of a concern in the parrot species than hemochromatosis. Now we get to toucans and the ramphastids. That is a primary concern, and that's why they make low iron diets. Minor birds also, and some others. But as far as and they all have their special diets that are low iron diets. Even if you give a low iron diet to some of these birds, like the toucans and minor birds, there is a genetic component that they will develop hemochromatosis anyway, even if you give them a low iron diet. Just like somebody that has a cholesterol issue, has high cholesterol, and you put them on a low cholesterol diet, and they go to the physician and they get a blood sample, and physician says your cholesterol is still up. You go, but I'm eating low cholesterol diet that you provided. You still have a genetic component that predisposes you to these type of conditions, but you do everything possible. For your parrots, I wouldn't say that this is a major concern. And and the vitamin C, what was the vitamin C?
Limiting vitamin C consumption, is that sufficient for preventing hemochromatosis in low risk species?
I don't think it's going to be significant, and I don't think that there's anything that I could say that would say, that limiting vitamin C would or wouldn't, because we just don't see this disease condition very much in companion parrot species.
Okay. Let's see.
And for the most part, I'm not aware of where people, just thinking back, where this would be where people are over supplementing vitamin C, or where in their diet that they would be getting vitamin C to the point where this would be a problem. And vitamin C is of course, a water soluble vitamin, so it's not like you can overdose it like you can with your fat soluble vitamins A, D, E, and K. But I just don't see where there would be enough that it would cause any problems one way or another with this disease condition that is extremely rare in companion parrots.
Okay. And then our next question is from Audrey. She said, will you take a bit, we talk a little bit about the vet exam for birds with feather destructive behavior. Like what testing is done, what are some of the physical causes and treatments?
Well, as far as, and I've mentioned this, as far as feather destructive behavior, it is significant to know the general history of and the environment that the bird lives in, what its normal behavior and the normal I guess activity within that environment, and it's also important to know its nutrition and the enclosure that it's in, or how long it's in it, how long it's out. This is it takes a significant amount of time to get all of this information, and you need to be able to provide this information to lay a foundation moving forward. Now, with something like this, we look to see, and we try to find out the information prior to the exam to see if there's anything that could be behavior related that's not medically induced, like there's not a disease causing this. Because as I mentioned before about the macaw that plucked its feathers out right after the dog and the baby came home the next day, that was all kind of a cause and effect. This is things that we're looking for. We're also looking for nutrition, because nutritional deficiencies can lead to this. And so laying that foundation, if we to look at this, there have been many different disease conditions and I guess reasons people have attributed to feather destructive behavior. Internal parasites, giardiasis, zinc toxicity is another one, and that's off the top of my head. And there's others that have been attributed to it, but there's no scientific evidence other than clinical observation that, oh, I had a bird that was feather picking, or I had feather destructive behavior. Feather picking back in the day when this came out, but feather destructive behavior. We diagnosed giardiasis, so we treated it and it got better. So giardia causes feather destructive behavior. May or may not, but there's no scientific where they've taken birds and inoculated them with giardia, and all of the birds started having feather destructive behavior. There's nothing scientific to back it up. So we take this information and we say, well, possibly. And then that's what we look at. We look at, we always look inside. I always say, I can look at a bird in the outside and say, it looks good, or it's got feather destructive behavior, but everything else looks good. But but you have to look on the inside. That's why we and physicians, collect blood, run tests to see what your body's doing. And so we do that. And also parasite intestinal parasite exams. We do that. And if there is a need or a cause based on the results and what we see on the physical exam, then we can go into imaging. We can do imaging if we see a need. If we see something that is kind of indicative of infection or inflammation of the feather follicles that may be bothering the bird, then we'll look at doing a biopsy or culture to see if there's a generalized bacterial infection going on. So it's not difficult to do this. You just have to perform the medicine in a manner to try to cover the bases and make sure that there's nothing there medically before you start treating behaviorally. And if there is nothing that you can see, then there's the possibility of doing behavior treatments. And we start with that to make sure they're on the best diet possible, to make sure that they have the proper nutrition, and then also the environment, to make sure that their environment is optimum for them, so that they are comfortable and that they're not stressed in that, and also provide foraging and to try to stimulate activity within their cage or outside of their cage, if that's the fact. So and then you go into, and so that's just leading up to the point of trying to determine if it's medical or not.
Okay, ruling everything out before you find maybe the targeted reason why, if possible. I know it's a frustrating condition for a lot of birds and their people, so it's good.
Oh, it is. And if there's nothing medically wrong, the nutrition's great, the environment is fantastic, then it's a situation of behavior issues. And when you're talking about behavior or psychological issues, that's more difficult to put your finger on. Yeah, that's it. That's what we're going to treat it with, and it'll get better. And when you're talking about psychological issues, there's a lot going on up here, and it's hard to target that. And so you want to make sure that you do or provide the treatment that, or the recommendations that are going to have the best, to give you the chance for the best results. And that could be medication, that could be behavior modification, different things like that. We all, many of us know about birds that had feather destructive behavior. The owners go, can't take it, can't look at the bird. Here, you take the bird. Next thing you know, the bird's not doing it anymore. Was it the environment? Was it the person? Was it, who knows? But this is, something that obviously there are psychological components to this. And once the medical reason, because with the medical reason, we can put our finger on it, we can treat that, and then that resolves the issue.
Fascinating. Wow. And so our next question actually has to do with diet. So Stephanie wanted to ask that for birds on a pellet-free, for example, chop-based or limited pellet diet without access to daily sun, should vitamin D be supplemented? If so, how are Uvb lights designed for parrots really enough, or should vitamin D be supplemented another way?
Well, I mean, if you're concerned about vitamin D or nutrition, and you don't think, and again, I always emphasize that there isn't a daily recommended nutritional breakdown for all species of parrots. There's very, very few that we know what the daily recommended requirements are of the nutrients for the birds we have. And they come from all over the world, all different environments, all different native food that they eat. And that served them well for thousands and millions of years, right? So we don't know that, and we try to provide the nutrition. I say we, as a whole, that the birds will do well on, and obviously, this is the commercial companies that provide diets are doing a good job because our birds are living very long and apparently in very healthy. But is it optimum? We're just not sure about that because we don't know. And if you want to provide nutrition, supplementation, and some people would say, if you feed this, you shouldn't provide any other supplementation. And I would argue, you show me the requirements for that particular species, and I'll agree with you if they meet that. But unfortunately, they're not going to be able to do that, and so if they can and it meets it, then you don't. If they take it in, and so that's like us. We don't know how much we're eating a day, do we? Are you getting your daily recommended requirements? What if you eat, something in the morning? Well, how much is that? How much is that? Well, I'm still kicking, so it must be good, but it may not be optimum, right?
Mm-hmm.
And so with that, that's one reason I take vitamins. But the birds, you can provide a vitamin supplementation, and Lafeber has Vivi-13, and then Necton vitamins. But you provide those vitamins. Necton S is a supplement, vitamin supplement that is kind of a multivitamin supplement, and for those vitamins, to, if you're going to do it, to provide those at the recommended dosage, and also how they are recommended to be administered, and follow that to a T. But so that's what I would say. If you have a diet that you're not sure, I'm not really, it just that's what I would say.
Okay, and about the UVB lights for
Yeah,
getting
but
vitamin D?
sure, I would recommend those highly if you can. And as I've mentioned with UVB lights or full spectrum lights, you have to make sure that they're at a distance to the animal that it's going to provide the optimum or any benefit whatsoever. You can't put them all the way up on the ceiling and say it's 5 feet from the animal and think that you're getting any benefit at all.
Okay.
I mean, it's given as much benefit as one of the lights that you have, LED lights that you have. It would be just as much. And then also you have to remember that it's at the appropriate distance that it says on the on that particular product. Number two, as it relates to that particular product, you have to know what the expiration date is on those, because the light will come on for years, okay? But the UVB effect is only good for how long it says on that package. It may be 6 months, It may be 9 months, it may be a year, it may be 3 months, but it'll tell you how long that's on there, that it's effective. But you could turn it on 5 years from now and boom, you got light, but you don't have any UBV, you know. And so this is something that you have to consider. Also, when you have UVB lighting, you know, UVA, UVB, you have to remember that you don't want any type of barrier from the light through to the animal. You want it to make direct contact. So that's helpful if you have a cage, because you have spaces between the bars, right? But if it's in a plexiglass cage, it's not optimum. Or if there is something that is between the top of the cage and it's not going to kind of like, ooh, I'm going to go around it, you know.
Yeah.
The little light rays will go around, they won't. So, you know, that'd be cool.
How long of the day can they be under the UVB lights? Is there a?
No, I mean, you know, you again, that's a good question, Laura, because you want to try to the birds, you want to try to provide, and there's different thoughts on this, but in the Andrew Lusher book on avian behavior, they, you know, he really recommends, and the nice thing about that book is that he really looks and talks to the experts and who contribute to the book to look at natural avian behavior and try to correspond that to behavior in kind of in a companion setting. And so he was mentioning, and I don't know if it was him or another author, about the need to make sure that the birds get their rest, and so when it's dark, it's dark. When it's light, they get up, and of course that's not always the case, but that may have an effect on the bird's behavior. So, you know, 12 and 12. 12 on, 12 off, that would be okay, and you can do that on a daily basis. You know, that would be just a starting point.
Okay. Let's see. And Anne says, I have a 27-year-old Senegal parrot who just had a checkup with an avian vet in January. All results, blood work, physical, were normal except for cataracts. However, recently our parrot has been excessively thirsty. The only other unusual symptom is that he's closing his left eye frequently. His diet is unchanged and his appetite is normal. Might anything come to mind as to reason why for the excessive thirst and the closed eye, if his checkup was normal?
Now, you know, 27-year-old Senegal is old. It's old. So yes, I would say when you're looking at the average age of your Amazons and your lifespan of Amazons and African grays being 30 to 40 in my clinical observation over the years. Of course, they could live longer. We've talked about that. Average age of somebody in the U.S. Is longer in other countries, is around 80. COVID's made it a little lower, but we all know people that live to over 100. But there's not many. So the average lifespan of those parrots are about 30 to 40, and then for the Senegals from 20 to 30. So it's not unusual to have lens opacities just like you have in other animals and humans when you get older. And sometimes those lens changes can affect the eye, and cause inflammation. They call it anterior uveitis, and this may be, it could be associated with the lens opacities. Also, when and this is something like this occur, you can have a situation where you have a corneal ulcer. It could have scratched its eye, and it's painful when you have you scratch your eye. And so these are all, and then you can do some staining to look at that. So that's some of the things that it could be with the eye, or it could have just traumatized that eye. And as far as I don't know if it's drinking an excessive amount of water, but that may, again, it could be related to kidney issues. It's very uncommon for birds to get become diabetic, but that is something that possibly an older bird could develop, where they you mentioned drinking a lot of water. I don't know if he's urinating a lot, but usually we call that polyuria, polydipsia. I would always think, well, it's PUPD. I think, well, you have to drink first and then you urinate. So I would think it would be better to be PDPU, but nonetheless, that's what they do. They say PUPD. That's just kind of digress there. But if he's drinking a lot of water, could be you'd be urinating quite a bit, but then they could do a blood glucose level to try to determine if it's a diabetic condition. Also, it could be something where you have renal involvement. They can get visceral gout. Visceral gout is where you have crystal formation that affects the function of the kidney, and it can affect other organs too. They can get articular gout in the the feet and joints, and it's painful. But the visceral gout within the body can affect the renal function, and we've had birds that have been polyuric, polydipsic, or drank a lot of water and also urinate quite often. Now it's difficult. It's difficult to diagnose the gout. Endoscopy, you can't see it radiographically, and usually endoscopy or a renal biopsy is what's needed for that.
Oh, okay.
All right.
Learn some acronyms and some.
Yeah,
It's good
and
stuff,
that you urinate before you drink.
there you go.
Polyuria, polydipsia.
Polydipsia. Okay.
Now we need
Our
to
next
change
question.
it right. Polydipsia, where you drink a lot. Polyuria, where you urinate. Whoever said PUPD, they're laughing.
All right, let's see. Our next question comes from Lee, and this is actually about their diamond dove. 2 years old, has a bent or bowed beak that has developed in the past year. And Lee wants to know if this is diet related or if it is a health problem.
It could be. It's more than I don't think, if it's been on a diet that you've been raising your diamond doves on as a under normal circumstances, a diet, and the birds have been doing well. I don't think it would be dietary related. I think that there could be possibly a genetic component on that caused the development of this. Early on, it could have been something during the development that was abnormal, that maybe as it was developing in the shell, not necessarily a genetic component, or it could have injured it some way along the line that caused some of the tissue to grow more than others, causing this bow or curvature. We'll see where the beaks that should be straight are curved, and then we'll see some that are crossed. And so it's usually related to, I would say, a trauma or injury or a developmental issue more than diet.
And what would there be a treatment option, or would it?
Not really, not
Yeah.
really. And it should be able to adapt without any issue, depending on the severity. It's quite amazing how well birds adapt to I guess conditions that aren't optimum. Like I was saying about the birds that we had to amputate a leg, or have to amputate a wing, or we have some beak issues or what have you. The birds are fairly adaptable on that.
Okay, that's good to know. And those are gorgeous little birds, diamond doves. They're beautiful.
Oh, yes,
I
yes.
love those birds. Adrian Adrian says we have 2 older birds, a Moluccan hen about 35-ish and a blue and gold macaw who's about 30-ish, that are developing cataracts, the tiny white dot in the center of the pupil. Can fluorescent or ED lighting cause this? She says she's concerned because it is in 2 of my birds. They are inside more than they were when we were in California because of the weather, black flies out here in Arkansas. So.
Yeah. And in Louisiana. Yeah. Be careful for the black flies. It's about that time again. But no, yeah, there may be some, but I'm not anything to be significant, to be worried about. It's age. Okay. Yeah.
And then Janie says, hi, Dr. Tully, what are your thoughts on using Medi-Honey on wounds, or I'm sorry, Dermagel? Are they ingestible? Any recommendations?
Yeah, well, wound care is extremely, it's a whole science to itself, and actually, Dr. Kelly Rockwell and I, and Dr. Spear's new book, have a chapter on wound care, and it's one of the most common presentations that we see, and we with wounds, it just depends on the wound, because there's so many different products, and you want to be kind of careful, somewhat careful on what you put on the wound to try to make sure that the wound heals in an appropriate manner. The one thing that you don't want to put on an avian wound is anything with corticosteroid in it, because the amount of corticosteroid in these products, and the ability of the bird to ingest this in these wound care products, topical application, will cause hepatotoxicity, and it can and will kill a bird. So with wound care products, I just want to mention that. It's so we kind of digress from the Medi-Honey situation, but it's assessing the wounds, and we get those from chickens to that the dogs have ripped off half the body, or ducks, or parrots, and I mentioned about the parrot where the leg was ripped off by the dog and was perching on that one leg, and so we do have these wounds, and no time do you want to put anything with corticosteroids. So you have to be careful, because you can go to the store, and as with most things these days, there's just not one product. Say Neosporin, for instance. There's 50 choices that you have for Neosporin, or triple antibiotic ointment. Now, what you don't want is to say, oh, well, we have Neosporin, but it's plus, you know, some kind of corticosteroid in there. And it's fine for you to put on, but not to put on a bird. And you don't want any of your birds ever having that put on their skin or a wound. Only the antibiotic if that's the case. And so meta honey or honey in general, as I said, we had a conversation about wound care. I had a master class at the AAV, and I was in my presentation was to honey, and mentioned about manuka honey, and that's manuka honey is supposed to be the end all of all honeys to provide you know, the benefits for healing wounds. But in the end, after about 20 minutes of discussing this, it seemed by all of the veterinarians in the group, at the end, it was Dr. James Harris. He practices in Tasmania right now, but he said, well, I guess the conclusion is some honey is better than no honey. So in that sense, if you have an open wound that's fresh, or it is somewhat moist, then honey is um, we use honey quite often. But the what you have to remember is that you have to, in wound care in birds, you have to be very careful, because the next thing you know, you have honey all in the feathers, they're all stuck together, they're over the wound, they're suppressing air or the wound to breathe, and then it's providing the possible environment, if it's not treated, for microorganism growth, not while the honey's there. But you have to be very careful with wound care. And I always say, when you're putting anything on wounds, that you need to put it on a Q-tip, and moisten that Q-tip and have just a little on there, and then you rub it on the wound to the point of glistening, where you actually see some application of that medication. You shouldn't see any excess. There should be no excess on that globs, as we call it down here, globs of things on there. And there should be no excess. It should just glisten. And then that way you prevent all of this from getting into the feathers and the bird ingesting it. And it actually is going to, what happens if you put an ointment or something like that on a wound, it's going to really reduce the ability of that skin, those cells, to have respiration. And so those cells need to breathe, they need oxygen to grow and heal. And if you put a film of ointment over it, well, that's just like, I can't breathe, and it's going to reduce that and and increase the length of time for that wound to heal. So it's somewhat of an art form, as far as, you just say, oh, it's a cut. Honey is good, but it's a point where you go from honey to something else to try to help that. And if it's a severe wound, then cleaning the wound, removing any dead tissue that we have to go through, bandaging to make sure that whatever you're treating that wound with stays on. Sometimes bandaging is for protection, sometimes it's just to maintain however you're treating that wound. Okay. And wound care is very important. So I think we got the meta honey, but was there something else?
The meta honey, and I think there was something else. A dermagel.
Dermagel, and dermagel, again, what we have used quite a bit in dermagel. It would be at a point where you're going to have optimum healing, and so I'm not that familiar with the use of Dermagel, but if it is somewhat of a protectant on that, or is somewhat of a non-toxic material that helps the wound heal, and there's a number of products like that out there, then that's fine, as when the wound's clean, you have a granulation bed, and that you're kind of on the last part of the healing process. And we use a product called Vet Aid spray. It's kind of a sea salt based non-toxic product that you can spray or have foam. There's foam. It's so you can actually spray the bird, but in the cage if you can't take it out or what have you. And so, but there's a number of products out there, and I am always looking for a new product. So the Dermagel, if you've had good luck with it, and at certain parts of the healing process of wounds, then Vetricin is another product that comes to mind. Then that would be no problem with that.
Okay.
But anyway, it gets into a whole nother area.
Yes, it does.
Some of these questions, yeah, we could go all week and talk about it, I mean, on some of these issues. So, got to say time out,
There we go. We'll have to do a wound care.
Yeah.
We can include burns in there as well, probably. So we have a question from Steve. He is curious about aspergillosis in general and syringeal granuloma specifically. Also, the role nutrition plays in Bumblefoot. So a few things in there to tackle.
Okay. Well, let's go to the role nutrition plays in Bumblefoot. The main cause of the main underlying, I guess, condition that develops into Bumblefoot is avascular necrosis. So what's that? That's where the bird is perching on the same points, pressure points on the perch all the time, and like on a round wooden dowel, and the weight of the bird and the inability of the bird to move around will cause pressure, just like pressure sores in humans that are paralyzed, or pressure sores that develop in people with diabetic conditions on their feet. They just don't feel the pressure on there, and so what happens is you have decubitus ulcers, and in birds, what happens is that they just perch, and then the vascularity to that area, that pressure point, is lost, and then the tissue, the skin, becomes thin, and then this happens in raptors that are in proper perching, or heavy, happens with heavy birds, that contributes, and then the skin breaks on the bottom, and that's inflammation, the break in the barrier that's protecting the interior of the bird from bacteria. It is open, and so it can become infectious. It's not necessarily infectious all the time, but it can develop into an infectious. So that's what causes, for the most part, pododermatitis or Bumblefoot. And of course, the bird can puncture it, or it can tear it, and a lesion develop. But that's why we see this in swans. That's why we see it in geese and ducks that are on hard surfaces. I've seen a Bumblefoot lesion on a swan about the size of a softball. It was dragging around, Okay, so this can happen in all birds, but it's pressure usually that's causing it. They're walking on rocks all the time. They're, you know, and or hard surfaces, and this is what leads to it. And nutrition, the only I guess what you would say um, link there is if they get or provided adequate vitamin A, because adequate vitamin A will help with maintain the integrity of your skin, okay, and other epithelial areas in the body, your respiratory, GI, reproductive, but ocular, but you have healthy skin, but it's still, you could have adequate nutrition and adequate vitamin A, but if the bird is walking like a swan on hard surfaces and pressure points or whatever are compromised, then bumblefoot will happen. So it's not necessarily nutrition, but it's the other. Um, it's the foot pressure. And so then it was aspergillosis.
Yeah.
Well, we could have an hour on aspergillosis, and I appreciate this question, Steve, but it's fantastic. It really is, because we see that quite often. And aspergillosis is, I'm breathing in spores right now. You are, we probably all are, to a certain extent. It's a ubiquitous organism within the environment. There are environments that are dusty, that have the hay organic material that they that really you can be exposed to more. So you want to reduce that within an aviary setting or what have you. But in general, there's no way that you could put an anti-aspergillosis cover over the cage and say that the bird will never have it or be exposed to it. And certain birds are predisposed. Again, African grays are notorious. I think that's what Alex died of. And so it's that's just, they just are predisposed more than other birds. And we've seen it in waterfowl also. But all birds are susceptible, but it's just extremely rare for other parrots to get it, other than African grays. We've seen penicillium. Actually, we've seen a pyonis with penicillium that was disseminated. So there's other fungal organisms that birds can get, that can be life-threatening or ultimately cause death. As far as the tracheal granulomas, that's mostly in macaw species. And I wouldn't say blue and gold, but I'd say in macaw species. And usually this is found in the syrinx, and it is nothing that you can do necessarily other than make sure that just the environment that the bird is in as optimum as possible, that you would be comfortable in. But the syringeal granulomas are caused, and it's at the syrinx, and the syrinx is the voice box of the bird, and it's at the bifurcation as the trachea windpipe goes down into the bird. It's right where it goes from to the left side of the lower respiratory tract and the right side. So it's the syrinx is at this bifurcation. So it's right there. That's where the voice box of the bird is. And so you say, well, why do they get these granulomas there? It's because you have, the theory is that there is, as the air is, you have inspiration, or what you have is a the air actually, what would you call it? It the flow is disrupted as it hits that bifurcation. So that's what you have, and so you have some turbulence in the air and the organisms down there. So there's the possibility of some of what they're breathing in actually settling in the syringeal area. And that's why, and I'm not going to say that's it, but that's what's been proposed as, or a rational thought process, I guess, or a reasonable thought of why it occurs in the syrinx, whereas you can actually have it anywhere within that tracheal lumen.
So would that be like if a cause if you know, would you notice like vocal changes in your bird? Would it be?
Oh yes, and that's usually one of the you may notice, because there is a reduction, of course, in some more than others, in the opening of the bronchi at that area as it bifurcates, or the area just before it bifurcates. We call that the distal tracheal area. So what that would be is that if there is a reduction in the opening of that trachea, either in the bronchi or in the trachea, that there may be some respiratory compromise there. And then also that you could get vocalization just in breathing, or abnormal vocalization when the bird is trying to vocalize, squawk, talk, whatever. So that would be something that you would want to actually assess if that was a presenting complaint. And so it's difficult to see on radiographic images. Sometimes, depending on the size and where it's located, you could see this on just traditional radiographic images, but usually we'll do a tracheoscopy where we take an endoscope and go down the trachea and look to see if there is any of these any granuloma formation. And if we see any suspect lesions, then we'll take a biopsy.
Wow. Well, that
and
is.
You can treat kind of topically too, that sometimes will have almost a real immediate effect at that site, although there's more treatment that you would want to give after the procedure.
Well, that is fascinating and a thorough explanation of those three questions for Steve. So I'm going to announce today's winner. We have a giveaway. We are giving away a bag of the Lafeber tropical fruit pellets, as well as a bag of your bird's choice. So today's winner, hopefully this will make your weekend and into the weekend here. This week's winner is Glenna W. So Glenna W, congratulations. You are this week's giveaway winner. So yay. Hopefully that makes you and your bird's day. And so I was just going to also give our participants a sneak preview of our upcoming webinars. I've got the next 3 here. Can you believe, February is such a short month. We're already heading right into March. We're marching into March, coming up very soon. So March 5th, we've got Heart to Heart with Chris Davis. And then we have March 12th with Dr. Stephanie Lamb. She's going to be presenting Where Do Baby Birds Come From? She's going to give us a veterinary view of avian reproduction. And then we have March 19th, we've got a Gray Parrot Anatomy Project, an update and relevance to parrot species. That's going to be by Dr. Scott Eccles. So some exciting webinars. Of course, we'll be revisiting hopefully with Dr. Tully on Ask the Vet, because this is extremely popular. We've got a lot of thank yous pouring in here, Dr. Tully. Thank you, learning so much. So you are definitely just helping a lot of people here with their birds.
Well, all I can tell you is that I'm very thankful for everybody that attends, because we all learn together, and that without them and the questions that they have, that we wouldn't have so much fun, Laura. And so and we'll continue to do what we can to help all of those little birds out there and keep them happy, healthy, and living long lives.
Yes, there we go. There's our takeaway for this. That's why we do it. So thank you. Thank you for those are some very big terms and very just it blows my mind away on how much knowledge you have of birds and in science and medical and all that stuff. Like that's amazing. So
learn every day. Every day is a new day, and I learn from everybody on these webinars. It's always learning. We're always trying to find out new things, and like I said, it's fun, and we'll continue to do it. But thank you, thank everybody, and have a great weekend.
All right, and on all that, on that note, all the best to you and your flock. Everybody have a safe weekend, and until next time, bye.
Bye.